This is very interesting case of Ross syndrome. As we know, the tonic pupil is a neurological disorder in which one or both pupils are abnormally dilated with delayed constriction in response to the exposure to the light. And there is a female preponderance. There is two types of tonic pupil. One is the Holmes-Eddy syndrome and second is the Ross syndrome. In Holmes-Eddy syndrome, there is tonic pupil with areflexia of Achilles muscles involving knee joint or ankle joint. In Ross syndrome, there is triad of tonic pupil, segmental anhidrosis or hypohidrosis with areflexia. Usually causes are idiopathic, but it may be due to the neurotrophic viral infection, eye trauma during peribulbar injection, or ischemic causes. This eye trauma and viral infections and ischemia leads to the inflammations and damage to the neurons in the ciliary ganglion and dorsal root ganglion. Many factors like autonomic denervations, autoimmunity, developmental origin, viral infection, and genetic factors may be attributed in the pathogenesis of Ross syndrome. The aim of the case report. As the Ross syndrome is very uncommon disorder, only few cases have been reported till date, only 50. So our aim was to share this uncommon interesting case on this forum. A 35 years female presented to outpatient department of ophthalmology, PMC Patna, with defective vision for distance in near since few months from the left eye. And there was also associated pain in the right foot at second two and recurrent knee joint pain in right leg. And there was also history of lack of sweating on right side of back and right side of the face. And there was no history of trauma, diabetes, hypertension. Patient was non-smoker, non-alcoholic housewife. On examination in right eye, vision was 6.6, in left eye was 6.24. And BCVA was 6/9 partial. Near vision N6 and right eye, left eye was N36. Ocular movement was full and free in all cardinal gauges. IOP was within normal limit. On pupillary examinations, right eye pupil was normal size, left eye was dilated, and there was delayed constriction on exposure to the torch light. This was also followed by the delayed dilatation observed on the swinging light test. On pilocarpine test with the diluted low-dose pilocarpine 1/8 times, pupil was constricted with the low-dose pilocarpine due to supersensitivity to the cholinergic innervation. Normally, pupil does not constrict with the diluted pilocarpine. Thus, diagnosis of tonic pupil was confirmed. On slit lamp examination, anterior segment was within normal limit, fundus was within normal limit. On nervous system examinations, ankle jerk was sluggish in right leg, and skin of face and back appears to be dry and scaly. On investigations, total hemogram was within normal limit, blood sugar normal, thyroid function test was normal, MRI brain and cervical spine was showing no any abnormalities. So, differential diagnosis, there are two strong differential diagnoses, that is Ross syndrome and Holmes-Eddy syndrome. Other differentials were the Horner syndrome, hereditary sensory autonomic neuropathy. Patient was referred to neuromedicine department for further opinion. Neuromedicine physician also was in opinion of, in favor of diagnosis of Ross syndrome. Discussion. Ross syndrome is characterized by a triad of tonic pupil, hyporeflexia, and segmental anhidrosis or hypohidrosis. In 1958, this syndrome was first described by the Dr. Ross. Anhidrosis and tonic pupil is due to involvement of postganglionic fiber of iris and sweat gland, but causes of areflexia are due to the impaired spinal monosynaptic connection. Segmental anhidrosis is also present in multiple sclerosis, diabetes, leprosis, Sayre-Drager disease. Usually, tonic pupil is unilateral, but may involve other eye also. In the tonic pupil, reactions to light is more impaired compared to the accommodation. And there is a light near dissociation. With progression of time, partial recovery in accommodation is observed. Defect of areflexia is permanent and there is no chances of recovery. And in Ross syndrome, there may be compensatory hypohidrosis. These are differences. Thank you very much, sir.